Understanding ADHD and overview. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental condition. It affects both children and adults. People with ADHD often have trouble with focus, impulsivity, and hyperactivity. These challenges are not a choice. They stem from differences in brain wiring and function. ADHD is more common than many realize. It is crucial to understand that ADHD is not a sign of low intelligence or poor upbringing. It's a brain-based condition that requires professional diagnosis and management. Recognizing the signs and symptoms of ADHD is the first step towards seeking appropriate support and guidance. The face of ADHD symptoms and behaviors. ADHD presents itself differently in each individual. However, some common symptoms include inattentiveness, hyperactivity, and impulsivity. Inattentiveness can manifest as difficulty sustaining attention, forgetfulness, and disorganization. Hyperactivity, often more prominent in younger children, can look like restlessness, fidgeting, and excessive talking. Impulsivity often translates to acting without thinking, interrupting others, and difficulty waiting their turn. These core symptoms can significantly impact various aspects of an individual's life, including academics, work, and relationships. Navigating interactions with ADHD individuals. Understanding and patience are paramount when interacting with individuals with ADHD. It's essential to remember that their behaviors are not intentional or malicious. They stem from underlying neurological differences. Creating a structured and supportive environment can be incredibly beneficial. Clear communication, consistent routines, and breaking down tasks into smaller, manageable steps can make a world of difference. Positive reinforcement such as praise and encouragement can also go a long way in motivating individuals with ADHD and fostering their self-esteem. Diagnosis and treatment of ADHD. Diagnosing ADHD involves a comprehensive evaluation by a qualified healthcare professional. This process typically includes gathering information from multiple sources, including parents, teachers, and the individual themselves. Treatment for ADHD often involves a multifaceted approach. This can include medication, therapy, or a combination of both. Medications, such as stimulants, can help improve focus and attention. Therapy, particularly behavioral therapy, can equip individuals with coping mechanisms to manage their symptoms and develop essential life skills.